Sophia Younkerman was 15 when she had her first surgery. Dr. Erica Valentine from Children's Hospital, Colorado, treated her over the years, and they join us now. Sophia, tell us briefly, you were an athlete.
Yeah.
And that's how you discovered this pain? What happened?
Yeah, so summer of going into my sophomore year, I was doing 3 hours of POMS practice and 3 hours of track practice, 5 days a week for a whole month. And I was in physical therapy already. And I brought it up to her. I was like, I'm having like hip pain, like my hip's been giving out on me. She's like, you should go see an orthopedic surgeon, just get an x-ray, just make sure it's nothing serious. Turns out when I got the x-ray, they're like, this is really far, like this is really bad hip dysplasia. Like it was very clear, you could see it on the x-ray. And so I started treatment with the hip team at Children's Hospital. We tried intervention pain stuff, like inner hip joint injections and stuff. And so I finally decided with all the pain, we were like, let's just get the surgery done. So in March of 2024, I got a PAO surgery.
Okay, Dr. Valentine, explain this a little bit. First of all, it's more common in babies, is it not, to diagnose this? And when you say severe hip dysplasia, you don't have a lot of options.
Correct, yeah. So hip dysplasia in newborns is the most common orthopedic disorder that we see in children. It happens in about 1 in 100 newborns. In Sophia's case, she had adolescent hip dysplasia, which really can happen from one of 2 pathways. So either a child can have newborn hip dysplasia that is treated to the best of our abilities, and yet they still have something called residual acetabular dysplasia, or in Sophia's case, her dysplasia was most likely, we call it developmental hip dysplasia because it really develops over the course of years.
Wow. I know you did the surgery, and then a lot of things happen when you're at Children's Hospital, Colorado.